confirmed number of coronavirus cases in Los Angeles County comes to 1,244,254. The confirmed number of deaths comes to 24,354. Here in Torrance, the total number of confirmed cases is 7,435, with total confirmed deaths at 218. Welcome to COVID-19 Today. I'm Christine Lee. It's 4 p.m. on Wednesday, June 2nd. Coronavirus cases continue to decline in Los Angeles County as the number of new daily cases, deaths, and hospitalizations continue to fall to new pandemic lows. Today, the numbers reflect 9 additional deaths, 120 new cases, and 254 people currently hospitalized in the county as officials share cautious optimism that the county is headed in the right direction. Under the state's blueprint for a safer economy, the county's overall positivity rate remains at 0.7%, with a daily positivity rate at 0.4%, which is among the lowest in the state and across the country. This data makes Los Angeles County one of the best places to avoid getting COVID. LA County Public Health Director Dr. Barbara Ferrer says it's thanks to the efforts of the public who have received a COVID-19 vaccine. As of Monday, a total of 9,382,912 total doses of a COVID-19 vaccine has been administered. In the county, 4,371,150 residents are now fully vaccinated, and vaccination sites can be found all across the county. Dr. Ferrer says county and city sites, mobile clinics, and community vaccination centers are all offering the shot without an appointment to make it as easy as possible to get the vaccine. Data reflects a large racial inequity in vaccinated residents among Black and Latinx adults compared to Asian and white adults. Dr. Ferrer encouraged everyone eligible to get the vaccine in order to receive the highest level of protection against the virus. You can get more information on the county's website at vaccinatelacounty.com. New research is showing early signs that booster shots may not necessarily be needed for COVID-19. Scientists have found clues that the world's leading COVID-19 vaccines are offering lasting protection, which could eliminate the need for additional boosters. Evidence shows that immunity from the mRNA vaccines made by Pfizer and Moderna does not depend exclusively on antibodies that diminish over time, as the body has overlapping layers of protection that offer backup if a person is exposed again. Evidence shows that antibody levels have also remained strong at least 6 to 9 months after mRNA vaccinations, and maybe even longer. So far, 62.8% of the U.S. adult population has received at least one dose of the COVID-19 vaccine, and 133 million, or more than 40%, are fully vaccinated. According to the U.S. Centers for Disease Control and Prevention, the rate of new vaccinations has slowed to about 600,000 per day. Researchers say more studies are needed, especially with virus mutations still posing a threat. The World Health Organization authorized Beijing-based biopharmaceutical company Sinovac with emergency use authorization for its COVID-19 vaccine, Coronavac. This is the second vaccine from a Chinese drug maker to receive the green light behind Sinopharm, which was approved in early May. This will give WHO's vaccine distribution program COVAX the potential to help vaccine-strapped countries to provide equitable global access to immunizations. According to recent reports from the United Nations Children's Fund, or UNICEF, as of May 17, instead of receiving 170 million doses, COVAX delivered only 71 million shots. WHO Director General Tedros Ghebreyesus said at a news briefing today that Coronavac was found to be safe, effective, and quality assured following 2 doses of the inactivated vaccine. This vaccine is recommended for adults 18 and older and should be spaced out between 2 to 4 weeks. Unlike other vaccines, Coronavac does not need to be kept at super cold temperatures. The ease of how it's stored is set to make it suitable for low resource settings. It is the 8th vaccine to receive emergency use listing from the World Health Organization. Many are remembering the life of Los Angeles County firefighter Tori Carlin, who was shot and killed by a colleague Tuesday morning at Fire Station 81 in the Agua, Dulce area. Carlin was one of two firefighters shot on the scene. A second victim, a 54-year-old fire captain, was airlifted to Henry Mayo Newhall Hospital in Valencia. The suspected shooter, whose name has not been released, fled to his home about 10 miles away and within minutes set his home on fire. According to sheriff's officials, the person believed to be the suspect was found dead from an apparent self-inflicted gunshot wound in a small pool on the property. Carlin was 44 years old and a 20-year veteran of the department. He leaves behind a wife and 3 daughters. Los Angeles County Supervisor Hilda Solis ordered all flags at facilities to be lowered to half-staff in honor of Carlin and will remain lowered until the end of the day of the scheduled services. Healthcare workers may get a bonus hero pay for working during the pandemic and putting their lives at risk during this historic time. That's what Torrance Assembly member Al Muratsuchi and Chino Assemblyman Freddie Rodriguez is hoping to do as they co-authored Assembly Bill 650. The bill aims to not only recognize the efforts of healthcare workers during the pandemic, but also encourage retention. President of the labor group Service Employees International Union, United Healthcare Workers West, Dave Reagan, who supports the bill, says many employers that would have to pay the bonuses under this bill have already received millions in federal funding during the pandemic. The bill proposes bonuses of $10,000 for full-time workers, $6,000 for part-time workers, and $4,000 for less than part-time employees that would be paid out in 4 installments. These bonuses would require hospitals, clinics, and skilled nursing facilities with more than 100 employees to pay medical professionals for their work during the pandemic. Eligible workers would include non-executive healthcare employees from nursing assistants and paramedics to registered nurses and doctors. The bill faces a vote in the Assembly this week. If passed, it would then head to the Senate for consideration. Under the legislation, hazard pay bonuses would be paid out next year on January 1st, April 1st, and October 1st of 2022. President Joe Biden is using the 100th anniversary of Tulsa, Oklahoma's race massacre to make a plea for sweeping legislation in Congress to protect the right to vote, as many Republican-led states passed new restrictions making it harder to cast ballots. President Biden vowed that June will be a month of action on Capitol Hill as Congress considers the legislation and said he will continue to keep fighting to protect voter rights. While Republicans say the recent bills passed or in discussion in their states are aimed at preventing voter fraud, Democrats argue that the measures are actually aimed at undermining minority voting rights. Most recently, Texas legislature moved closer to passing a bill that would reduce early voting hours, tighten voter identification requirements for absentee ballots, and eliminate ballot drop boxes and drive-through voting centers. Senate Majority Leader Chuck Schumer told colleagues that he would be bringing the voting rights bill to a vote the week of June 21st. Universal Studios announced plans to hire more than 2,000 people. Positions at the theme park range from full-time, part-time, seasonal, and professional careers. Potential candidates can apply to work in a number of different departments, from attractions and entertainment jobs that include production assistant and show controller positions to guest relations, park services, retail, and parking jobs, along with bartenders, baristas, cooks, bakers, food stand attendants, and runners. Professional jobs are also available in the finance, marketing, human resources, engineering, environmental health, and safety departments, as well at Universal. You can go online to see what jobs are available at jobs.universalparks.com or nbcunicareers.com. Amazon's date for its biggest 48 hours of online shopping was announced today. Company officials say June 21st and 22nd will be when this year's Prime Day will take place, where Amazon shoppers will see some great deals online. The company launched Prime Day in 2015 as a way for shoppers to score big discounts and deals like Black Friday, but during the summer. In 2020, during the pandemic, Amazon delayed the shopping day while also turning it into a two-day event and reported a 60% increase in sales over 2019. Company officials say this year's events will have more deals than ever before, with more than 2 million deals globally, with savings across every category. In a survey by analytics company Profitero, one of the 1,300 people polled, 63% of them say they plan to shop Amazon on Prime Day, and a third will also shop competing sales. Nearly 60% of consumers say they plan to price check Prime Day deals on other sites as well before buying on Amazon. Buyers must sign up for a Prime membership to be eligible for the steep discounts and sales offered on Prime Day. Membership costs $12.99 per month plus taxes. Economists at UCLA's Anderson forecast say a brighter economic future is on the way for California, as the state is expected to fully reopen on June 15th. Experts say the stage is set for a fast and full recovery as consumers are ready to spend and return to some normalcy. UCLA's Anderson School of Management shared its June 2021 forecast as it remains optimistic and anticipates a robust recovery. The forecast includes moderately higher inflation in the short term, housing and services driving the recovery, and employment levels returning to previous peaks over the coming year, with some sectors like leisure and hospitality not recovering until much later. The nation's gross domestic product is forecast to spike 7.1% this year, tapering to 5% in 2022 and 2.2% in 2023. Music fans got some exciting news as Coachella and Stagecoach organizers announced the return of its music festivals in 2022. After a 2-year hiatus and multiple date changes over 2020 and 2021, festival organizer Golden Voice announced both will return next spring. April 15th through the 17th and April 22nd through the 24th are slated for Coachella, then April 29th through May 1st reserved for Stagecoach. Golden Voice officials say it typically takes 12 to 18 months of planning for both of these festivals, and headliners for both events will be announced in January, when general admission and VIP tickets will go on sale. Coachella was first launched in 1999, offering a wide range of contemporary artists to perform at one venue. Stagecoach was later launched in 2014, a sister event to Coachella for country music fans. With less than 2 weeks until the state's anticipated full reopening, the city, nonetheless, the state would not have survived this pandemic without the hardworking staff at all of our hospitals. Particularly here in Torrance, we're lucky to have access to 2 major hospitals that continue to rank in the top best list for patient care, services, and much more. Today, we head over to Providence Little Company, where I had the chance to visit and see what important message they have for everyone at home on this Wellness Wednesday. As COVID numbers go down and vaccine productions ramp up, we're checking in with one of our local hospitals to see how they're doing. Joining me right now is Dr. George Vernis with the Providence Little Company of Mary Medical Center here in Torrance. Thanks so much for joining me today.
Thanks for having me.
So how has the past year been? Can you walk me through your personal journey?
Sure. So it's been a kind of a roller coaster over the last year. I think the pandemic started about a year ago now. We were all very fearful coming to work back then. We didn't know what was going to happen with the virus, if we were going to get exposed, if we had enough PPE, if our PPE would work. So it was very fearful back then. Luckily, our spring kind of surge was not as bad as we expected. One kind of consequence of all the stay-at-home orders is actually our volume of ER patients back in April and May dropped by 70%. So we really had a precipitous drop in the patients just coming for routine care, and I think really in fear of getting COVID or catching COVID or being around COVID patients. So that was the initial first surge kind of experience. We got through that. Once the first surge was over, the summer kind of turned back to normal. COVID was always there, but patients started coming back to the emergency room. But one thing we did notice is during that April-May time, people delayed real serious symptoms. They had chest pain, they had heart attacks and strokes, and never presented to the hospital and had worse outcomes. So that was a concern early on. After getting through the fall, and then this latest surge was much, much worse. Kind of in the spring, our max COVID patients in the hospital was 80. We were down to the 10s and 20s in this fall, and our peak in January was 180 patients in the hospital at one time. So this last surge was much, much worse in the spring, and it was very challenging to all of us. One nice thing is that most of the caregivers had already started to get their vaccine, so that fear of catching COVID from your patients was much less.
Yeah.
So luckily that second surge is over, and we're in a much better place now. So it's been a tough year.
At the peak, how many hours do you think you were logging per shift?
So, you know, in the ER, we have dedicated shift times, and so we come and go on those times. We didn't really need to have extra hours. In fact, again, like in the spring, our overall patient volume in the ER has been less than traditional, so we have plenty of physician coverage for the patients that we had.
Well, you and those at the hospital, I mean, you're experiencing such a unique journey together. How were you able to support each other during that time?
There's a collective need. I think we're all comrades. We're all here to work together for the community and our patients, and so the physicians and the nurses and nurse practitioners, we all work together as a team to help the patients in the ER and the hospital. I mean, we work closely with our hospitalist doctors and ICU doctors, and we're here to treat our patients. I would say, our administration has been very supportive of us. And one thing I noticed at our hospital compared to ones I've seen in the news is that even when we are at our peak, our ICU was full. Many hospitals then turned their ERs into extra ICUs and really limited access to the community. Here at Little Company, our administration did an amazing job of expanding our ICUs, having those 180 patients in different parts of the hospital. It allowed our ER to function really well even during the worst times of the last surge.
Well, that's great to hear. And as COVID numbers start to go down a lot now, are you thinking about unwinding?
I would say yes. We're still holding our breath. I think the most unwinding I've done so far is just to go about the restaurants that I like to go to that are now open. We can at least sit outside. So I think that's about it for me.
Mm-hmm. And for me, as a non-COVID patient, the thought of going back to a hospital type setting honestly worried me. I'm thinking that there are people with COVID that could have walked down the exact same hallways. Now, is this a common fear a lot of patients have? And what can you say about the safety of the hospitals now?
I would say it's a very common fear. I mean, as I talked about the numbers in the spring, and even now we're still down from our ER patients, that it is a fear. It's a very rational fear, but what we've learned over the last year is to do the best practices of infection control. We test every patient that comes in the hospital for COVID. They go on dedicated units. So there really is little to no chance of being exposed to COVID coming to the hospital or a medical setting at this time.
Yeah. And why is it so important for people to stay on top of their health right now, be proactive and not delay care or screenings?
Like I mentioned in the spring, we had a lot of bad outcomes. People delaying care, not coming to the hospital for their chest pain or stroke-like symptoms, and then they had worse outcomes, or delaying their abdominal pain, and now their pen has now burst and they're having a worse outcome. So all those reasons, don't wait. If you have any symptoms that you're concerned, our emergency department's open. We have plenty of capability to see you. Infection controls are all in place. All our caregivers pretty much have been vaccinated. So there's no fear. You should take care of your health, and we are here to take care of you.
Thank you so much, Dr. Vernon, for sharing your thoughts with us today.
Thanks for having me.
And as he said, hospitals are doing all they can to keep you as safe as possible, so don't delay and make that appointment today. Thanks so much to Dr. Vernon. Looking forward to a follow-up conversation soon to see what the next steps are for the hospitals when we emerge from this pandemic. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. It's no surprise the city of Torrance made another list of best places to live in the U.S. According to niche.com, a website that compiles profiles, ratings, and reviews for places to live throughout the U.S., ranked Torrance along with these other California cities: Pasadena, Carlsbad, Santa Clara, Sunnyvale, San Francisco, Irvine, and Berkeley as best places to live. They accounted for best places to raise a family, most diverse, and best for young professionals or retirees. Niche also factored in overall livability, including quality of schools, housing trends, employment statistics, and access to amenities. With plenty of open park spaces, great schools, proximity to the beach and freeways, access to one of the largest malls in America, 2 major hospitals, top-ranked police and fire departments, and much more, it's no surprise Torrance continues to be ranked among these best cities. Another reflection of how Torrance cares. We love to hear these kinds of stories. Now, if you have a great story, upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you here tomorrow as Bella Shaw brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.